Okay. Welcome everyone to this webinar in our series of webinars about building resilience in a climate of uncertainty. Before we go any further, I'd like to start by acknowledging that I'm coming to you today from the lands of the Wurundjeri people of the Kulin Nation, and I take this opportunity to pay my respects to their elders, past, present, and emerging. The topic that I'm going to talk to you about today actually weaves together almost the entire career that I've had over the last few decades. Um, Most of my work, as you know, has been on financial health and well-being. And you've heard me talk about the fact that financial health and well-being is so closely linked to physical health and well-being, as well as mental health and well-being. So what we're going to focus on today is mental health and well-being, and how financial health and access to mental health is something that is a problem that is emerging in Australia. Today, we'll be focusing in particular on the mental health of school children, because some of the data that we see is quite alarming. 1 in 7 school children aged between 4 and 17 in Australia have had a serious mental illness reported in the last 12 months. And even primary school children are presenting with issues such as serious mental disturbances, anxiety, as well as depression. So it is my pleasure today to hand over to Anna to talk to Nathan about psychology in schools. Over to you, Anna.
Thanks so much, Vinita. And today I'm on the land of the Darug and Guringai people, and I pay my respects to elders past, present, and emerging. And as Vinita mentioned, we're lucky today to have Dr. Nathan Castle, who is the Director at Psychology Outcomes and Co-Director at Psychs in Schools. So Nathan, I'll hand over to you to introduce yourself in a little bit more detail for those in our audience who may not have met you before. So really good to understand a bit about your background and the organizations that you work for and that you're directors of.
Absolutely. I'm really happy to be here. So, my name is Dr. Nathan Castle. I am a clinical psychologist, and most of my career has been not only about providing treatment for mental health issues to improve well-being and functioning, but actually measuring to see if it worked. And that's a piece that I've found in our industry, in psychology, that is somewhat of a missing piece. So, in terms of my kind of passion area, it's about being basically obsessed on creating services that make a measurable difference that can be shared with the public so that when you're considering, is this mental health service good for my child or myself or my family, you can actually see the evidence that on average these things are highly effective. So as a co-director of Psychs in Schools with my wonderful friend Jesse Diggins, we basically created a youth mental health service that's embedded in schools that is heavily evaluated and benchmarked, with the idea that if we're going to be able to come to children and families in schools and provide free care, that's not enough. It also has to be high quality care. And that's been a big part of our kind of mission in Psychs in Schools.
Yeah, and I can definitely appreciate the value of working, with data. I love data. I work for a
Mm.
research organization called Nature, and I think that's, finding evidence-based solutions is really important, especially to give that credibility, but also to just keep an eye on outcomes and how everything's going. And it's interesting, I guess, considering right now the role of supporting children when we think about how that leads to adulthood as well. Some recent Nature research we conducted that showed that optimism is quite low among Australian adults. I think particularly the current climate we're in, there's a lot of uncertainty, there's a lot of pressure, and people are feeling less tied to their community and more focused on just themselves. What can they do to get through? And I think it's really
Mm.
important if we're looking at children and how they can be supported and how that actually leads to better outcomes in the future when they're older, when they're parenting as well, all these kind of future stages. And I'd love to
Mm.
know a little bit more about the kind of the when you set up psychs in schools, what was already existing, what support already existed, and not what you felt was missing that led you
Yeah.
to set this up and what you were hoping to contribute.
Yeah, I think that there is a lot of opportunities at the moment. And, that comes with when people are struggling, there's many ways that we can support people. As we looked at the landscape of younger people and what they had available to them with mental health, everyone was trying really hard and ultimately often doing a really great job. But it was thinking on a smaller level of, all right, if I'm the psychologist or the social worker or whatever discipline that can help the mental health and well-being, they were thinking on a one-to-one scale, as in, I'm going to have a room and the Smith family can bring little Sally over to that room and get an hour of care. Now, that is obviously something that we need, that one-to-one view. But what myself and Jessie were thinking more was thinking at a larger level. All right, how do we first start with access as the key? And so within every school is hundreds and hundreds of kids that some of which need help, and often the teaching staff know who need help, right? So what we started to think about was, all right, to solve the problem of access to a broader range of people, let's have our customer being the school and approach the school. And we started very small, just approaching a few schools in our local area and saying, hey, is there a need for psychology? And I tell you what, they were pretty loud about they need that. And then we worked with them to say, basically, can we work within your community, as in the school community, have a room in your space so that when we think about access, it's not only that the customer is the school, so it's a free service, but access also means that mum and dad don't have to get out of work, drive to the school, and bring them physically to another space, which is really hard to do sustainably. And for good mental health care, you need consistency and sustainability. So in this scenario, when we started, we simply put a trainee psychologist within the school grounds, and they would go out, the teacher would identify who would need support, and they would just bring them to a room 20 meters down the hall, right? In a space that they already know, already feel comfortable. And then because the school is our customer, we can also capacity build the teachers, and we can talk about interventions or supports that are helpful. So we're moving away from this idea of one-to-one and going, all right, how do we enter a community? And that kind of idea of rising tide lifts all boats. Yes, we can work one-to-one, but we can support the teachers, and access is the key. I think when we look back now and look at Psychs in schools, the real value in it is it's easier than being a parent and trying to find somewhere to take your child because we're already there. And I think when you just simplify what access is, something being easier is a good kind of reductionistic approach of like, all right, well, if that's easier than the status quo, that's a good solution.
And is there an element of financial or of personal finances that ties into that in terms of access and the ability to access, and even the perception that access is something parents could seek out for their child when thinking about the role of affordability?
Yeah, in terms of affordability, it's a big one. We do know that there's a huge proportion of Australians being adults or families looking after children that just cannot afford it. And so in this model, schools actually have funding for mental health and well-being, and they choose to utilize Psychs in schools from part of their budget. So what they're looking for from their finances is this kind of return on investment, that children are getting better, more engaged in the school and the community. But in terms of the cost for the families, that it is free for them, right? And so I think even talking about that mode of families needing to, at times, use their money to support for the healthcare of their child that might actually stop them from buying food, right? Or other things that they need. I think that's the equitable part of this. Now, can we provide value to every single person that we meet? I would say no. Can we provide value, like measurable value, to the vast majority of them? Yes. And for those that need more, that's where we would start that journey of having psychology treatment, have sessions each week, meet with the parents, and then speak to the parents and educate them around something like, all right, well, what you didn't know about young Sally is that she's actually facing these mental health difficulties. Now that we're clearer on what the issue is, we've gotten some gains for you throughout treatment, and we would recommend X, Y, and Z, whether it's an OT, another psychologist externally, whatever it might be. And I think that when it comes to these families spending money, often hundreds of dollars, it's too hard to spend that money if you don't know what the problem is clearly and you don't know what the options are. And so in this scenario, we find that our families are fine to have the free service if it doesn't give the kind of outcomes that they're looking for, and there's more that is needed for a smaller percentage of children, then they're at least empowered to use that money on something that is going to work. And they're also informed as to why that is something that is worthwhile, rather than just being in the dark and uncertainty.
That makes a lot of sense, especially given the overload with choice. That parents might be looking things up online, going, these are the symptoms, and there's 100 other things coming up, and it's too much. Whereas if you have a professional
Yeah,
say, this is something that we've noticed, this is what we would recommend, it just completely, demystifies and just gives them a clear pathway that they are then empowered to choose or not choose. It gives them the choice to do something, or if they
yeah,
don't want to do something, it's kind of up to them without the pressure. I think that's a really
absolutely.
good way to think about it, especially with the role of personal finances. And then they can make the choice to, if they can, put forward the funds to do that.
Yeah.
And in terms of your experience with this process, is there anything that you think has gone particularly well? Maybe we start with anything that you think has gone particularly well, and then maybe we'll speak about some of the challenges.
For sure, for sure. Like any new endeavors, from what we know, Psychs and Schools is the only kind of placement provider doing this kind of work. So, there's some real benefits and things that we celebrate, and there's been some challenges along the way. I think for me personally, and this is a bias of mine, as I told you before, I'm obsessed with the idea of providing more value, is from the very start, we actually got these young people to rate how they're doing in their well-being and functioning every single session, and to rate the helpfulness of the person providing them with the therapy, with the idea that we can use their voice to basically have a look at, are you getting better? If you are, let's keep doing what we're doing. If you're getting worse, let's provide you with more supports and a tailored approach to your treatment. Because we've done that, when you look at the results over the last 3.5 or so years, what you find is that the actual effectiveness of Psychs and Schools, even though we're using trainee psychologists or provisional psychologists, is way above international benchmarks, way above, right? Like, so to put it into context, usually what you would find on average in a mental health service is around 64% of people getting better. We're looking at this semester like 82% of people getting better. The top end that we've ever found anywhere in the world is 90% of people getting better. So we're not that far off. And I would say that the celebration, and by the way, that was a surprise to us, right? We didn't really know that that would be the results that come out. And I think part of that is that we're using early career psychologists that are hungry, they do a lot of prep. They're heavily supervised by senior psychologists, like, basically an hour every day that they work or more. But also what we talked about before, which is there's a consistency to this. We're down the hall in the community, and when Sally attends or Billy attends every single session, they're just more likely to get better. Right. And so I think that is a big celebration for us, that the actual embedding within an existing community gets better results, plus the way that we work tailoring treatment to each individual seems to get better results. And yeah, for me, I think that's been a career highlight, to be able to show that actually a lot of these early career psychs are getting better outcomes than me. And I've been working for like 12 years, and that's only a celebration, right? Like, I shouldn't feel a sense of ego depletion. I should think, great, we've found a way to support more children getting better results.
It's also interesting. I like this perspective that the younger, newer psychologists are doing so well because they're so hungry to learn. I think often you speak
Yeah.
about, not you, but people will speak about experienced professionals. They need decades of experience to really make impact. And these are young people who remember being in school because it was a few years ago and
Yeah.
hungry to learn. They're asking their mentors to get advice. They really want to do the absolute best they can. And, they're not probably jaded. They're not necessarily
Yeah.
cynical. Like, they really want to make an impact. And I think that's a really exciting way to think about it. And, when the results you're getting, 82% getting better, that's just, really what a testament to the work. But it's interesting
Yeah.
thinking about who is helping support those results. And it's, yeah, that's really great. That's really exciting to see.
I think also, just to add to that, there has been a twist in what we've realized since we started, and this was not wisdom that we necessarily knew from the beginning. But the emerging research over the last 10 years indicates that mental health practitioners, particularly psychologists, but I would say it's likely for all mental health practitioners, get slightly less effective on average with time and experience, not more, right? And a big part of that, I suspect, is because we get into the groove. We see a young person or an older person, whoever, and we go, oh, I know how to treat this. And we don't take the time to ask the client, are you getting better? For them to, rate for their well-being and functioning, whether they are getting better or how they rate the helpfulness. And so we're not allowing that data to come into our lives and surprise us. So I would say that I think, we talked about at the start this reducing optimism. When I think about our younger psychologist or early career psychologist, I'm filled with optimism because I think they're going to change the trend.
That's a really interesting point with people autopiloting, as they do in many industries, where you can just, oh, I've
Of
seen this,
course.
I know these symptoms, I know what that means, here's the treatment. And actually, someone who's newer might have gone, feels like it's this, but maybe it's not this, and really building out the story and getting the feedback and continuously looking for that data. So I think there's lots
Yeah.
of things there that are potentially leading to the success, also just the presence in schools, the consistency, it's not, oh, I need help this week, but no one's available. So yeah, it seems like it's
Mm.
all coming together. And on the other side, I'd love to know if there are any challenges you faced, either that you expected or things that have come up that you're kind of didn't expect, or just things that have been a little bit more difficult.
Yeah, absolutely. I think so. It hasn't been without its challenges. I think there's a few layers to that. So, number one, when we started, we were very conscious about working from a point of like equity and particularly reaching out to schools that would never otherwise get help. And so that was our foundation, working with schools and communities that might have a lot of cultural diversity or refugee kind of areas. And what we found as well that challenged us was that in some of the communities that we work with, we have to have what I would call like a systems lens, right? You can't really just work with the child in isolation, right? And so in our model, the challenge there is that we've got trainee psychologists who do a really great job and are hungry, but it probably is an elevated skill to be able to work with a young person, consider their family and their families of origin, and how to work in a way that is really holistic. And so at times, some of our challenges have been around, all right, how do we give the best care for those communities that are a bit more complex, not even necessarily in their mental health, but just more complicated in terms of how to work and kind of tailor that to families. While we don't necessarily have the solution because it's completely unique, right? Each time we find a school with different needs, we really try and get their feedback around what it looks like. What we've noticed is to overcome that is working with less children rather than more, right? And I know that sounds maybe backwards when you're trying to create the biggest reach, but honestly, if we support 20 kids and only two of them get better, I would prefer to work with 8 kids and 7 of them get better, right? If we're really focused on value. So I think that's been a challenge. I think the other thing is in terms of our service, we actually don't get any funding, and the schools cannot get any funding for our service, which has been a challenge. When we first started, we had a lot of access to funding through things like the school's mental health manual and those kind of things. And despite the kind of results that we show, ultimately, the Department of Ed kind of identified that because we use trainee psychologists, that it didn't kind of fit in their remit of funding. So I think the other challenge is, while we're absolutely much cheaper than employing a psychologist in the school, there is a financial component of it. So for us to run it with all the training that we have, all the supervision that we have, some schools, even with our low price, don't necessarily have the budget to afford it. And so we haven't solved for that yet, but we're thinking a lot about, if our motto is trying to reach, kids in every corner, then how do we try and have that kind of fee structure where other people can access it? So they've been the two big challenges: one on kind of supporting unique communities, and number two on whether they can afford our service, even though it's a lower fee service.
An interesting challenge as well, given we were talking about how part of your success is from these trainee psychologists, and yet the lack of experience means they're less likely to be seen as worthy of funding, or it's the thing that's working
Totally.
really well is potentially the thing that's holding you back, which is a challenge.
Yeah.
I guess the nature of government funding, there's always elements of things need to fit in certain boxes potentially, but
Yeah, yeah, exactly right. And so I think that's the thing, I also think that because we're the first of our kind, Psychs and Schools, a scenario where you're working with trainee psychologists from universities and embedding them in other communities, it's no wonder that there's no box for us with funding, right? Like, if you're doing something truly innovative, then by definition, there's not necessarily a stream of funding. However, I think as we look to the future, and I can notice over the latest trend, I think, in kind of healthcare and economics, is to think about, are people getting better? If you fund a service, is there some kind of measurable output? I would say that, we're maybe just a couple of years away from funding being focused on outcomes. And at that stage, we've already laid the groundwork. We have thousands upon thousands of data points showing the value. And maybe then that's our time to be able to reach those communities that could not otherwise afford our service.
And that leads me to the next question, actually, around the future and your ambitions for, what's coming next. And you mentioned the data-driven practice and the feedback-informed treatment, which I think sounds really key to how your service or your organization is working. You know that the treatments are working because of the data focus. Do
Mm.
you have some examples of how you're using some of these evidence bases, some of these data points, and also how this is informing your goals for the future, or what you feel could be achieved in the future?
Yeah, absolutely. I think so at the as we look to the future, we talk about things like growth, but growth doesn't happen unless we focus on the two people in the room, in the therapy room. And so the way that we're currently using data to increase quality so that we know that we can grow is that when a child is rating that their well-being and functioning is getting worse, it basically, our system lights up red. And that triggers our psychologist to not only do something different in the room, but to escalate the care to a senior supervisor, who can then overlook what's happening with the young person, potentially provide more recommendations. We also have the supervisors to observe sessions in those cases. So basically, what we're focused on is, we're not focused on everyone getting better. We're focused on every individual child getting worse. And then we're escalating the support, the supervision, the oversight, and becoming more creative about how to help them. So because of that, at the kind of smaller level, what we're planning to do is to grow within other schools within Victoria that would be government, Catholic, and independent, in part kind of showing that what you're getting here is like really high quality care. And then the idea is to then move into the other states across Australia. And some states are doing a great job. Like WA already has a kind of government version of this going really well. So I think that is something that can just thrive. And we can look at any other states that don't have this kind of service, basically don't have any opportunity to get a psychologist in their school. and grow into those areas. The key to that, though, is us making really good relationship with universities. Universities trust us a lot, and we've built that over time. It doesn't happen instantly. So a big part of what we look at as we move into other states, whether it be Tassie, New South Wales, or anywhere, is let's make sure that we're partnering with universities and understanding, what training needs do your trainee psychologists need to make sure that we're meeting those needs as well as the schools that we go into. So hopefully within the next few years, you'll see Psychs in schools across Australia into other states.
Yeah, well, would definitely love to see that. I've got a couple of friends who are teachers who I know would just be so excited by this concept. We're in New South Wales, so I can imagine that's something
Love that.
would be really good, especially just given what we know about how adults are feeling. I can't imagine what it feels
Yeah.
like to be a kid right now where you've had COVID, you've had so much disruption, there's so much, so much happening. It's a lot.
Yeah. Yeah, and I think it's a lot on the teachers as well.
Mm.
Often what we find in terms of the kind of feedback that we get in schools is basically a sigh of relief from teachers because they're like, I have to be a teacher, I have to be a social worker, I have to be a psychologist, and that's not their job.
Yeah.
So to be able to have a psychologist in the school that goes, hey, I'm working with little Sally or Billy, and I'm doing some emotional regulation. Here's a resource that we've been using. Maybe you can use it in the classroom, also helps the teachers to have a bit of
Mm.
confidence as well.
Yeah, that ties in with just positive community outcomes where parents feel like they've got more support, kids feel they're being listened to, they're being taken seriously. You're supporting the trainee psychologists build their careers as well, but also, the teachers, one less thing to potentially keep them up at night.
Yeah.
Um, and you mentioned the importance of the partnership with universities and building trust, and part of that
Mm.
is the psychology students having support with these supervised placements. Do you have some details for us in terms of how many students you've helped and what their experiences have been, and then some of your ambitions for them as well?
Absolutely. So for the provisional psychologists, at the moment, we're running over 100 placements a year. So that is a huge amount of early career psychologists going through and learning within the school context. Right. And actually, when you look at how many psychologists choose to work in schools, it's very few. So being able to talk to early career psychologists around the fact that schools are a great place to work. You can create a really big impact. There's a community around, and not all, I guess, career pathways as a psychologist have a community around you. In private practice, you're much more likely to be isolated or, within a room just with your clients. So we're helping over 100 provisional psychologists at the moment go through training for around 6 months in schools. And our hope is that some of those as well stay in schools once they go outside of their career so that we can have that kind of more long-term effect that we can help within schools and then more psychologists are coming around in that loop to work within the school context because it's enjoyable. And then for our university partners, there's a few things that we do to try and understand what they need, which is we provide lectures within some of the universities on kind of key topics like feedback informed treatment, empowering the voice of clients. But we also send them our evaluation results every 6 months so that they can see, all right, in these placements, how much change is actually occurring. So not only are we showing them the evaluation results of things like how many kids are getting better, but also the rates of confidence and skill within the provisional psychologists. So being able to show that, all right, at the very start, your first 2 weeks as a trainee psychologist, you're pretty nervous, you're going into a school, by the end, you feel much more confident to be able to do that work. So yeah, we try and I guess an ethos is to be able to disseminate the knowledge that we are creating and developing within our service and being able to share that knowledge to key stakeholders, whether it's the schools, whether it's universities. And what we find is that is often taken on really well because although it's not a randomized controlled trial research, it is real world data, which is often slightly messier, slightly harder to do. But when you've got an actual summary of what the outputs are or outcomes are of these placements, I think it really hits home and builds more trust between us and our uni partners.
Yeah, I love that. And it's using the data to again inform the fact that this is working, but also to hopefully encourage more studying, uni students to pursue this pathway and make impact in this way, which hopefully then helps you when you're expanding nationally and getting other unis on board and really kind of having that data at the heart of why it works and why this should be implemented elsewhere.
Mm.
And final question, I guess, when we think about the roles that different organizations can play in terms of improving outcomes. I think there's, Vinita spoke at the beginning about mental health and financial well-being, how closely interconnected they are. Who do you feel has the greatest role to play when we think about improving outcomes such as financial resilience and wellness? And who do you think would make the biggest impact?
Yeah, I think I might give you two answers there, Anna, if that's okay. My initial urge, and I'm a parent, is to say the parents, right? That they are kind of the heart and souls of families, and then tied together, they become communities. But I think that's an oversimplistic answer. I think it's all of us. If we are truly working together and we find this important, and I have not met a person yet where you say, is well-being and mental health important? It's like, nah, that's not important at all. Like, we all think this is important. What I think is the opportunity here is there's so many people that believe that we need change and improvement. What is missing is how do we work together to get that, right? And I'm talking about professionals, I'm talking about government, I'm talking about families, and I'm talking about individuals. And I think what's missing there is a common language. If you talk to a psychologist, they're going to say it in these words. You talk to a mother, they're going to talk about these words. You talk about a teacher, they're going to talk about it in these words. And so if we can find a common language between us that is talking about there's many different ways to improve these outcomes and that we all have a role to play, I think that that is going to be the biggest opportunity. We already have large communication channels, whether it's social media, email, we're hyper connected. And at the moment, it's used for rubbish, right? It's looked at cats and memes. But I do believe there's a future where we can communicate in a shared language about supporting and improving this domain of life and to that other domains of life. And this is my bias. I suspect it's something to do with, this is how many people are getting better. I think that is something that everyone understands, right? Is it hard to measure if someone's getting better? Yeah, a little bit. Is it impossible? No, absolutely not. And so I kind of dream of a world in a future where we all have a role in this and where we talk not in terms of like what support was provided to increase outcomes, but talking about the outcomes themselves, such as, oh, we heard this service over in Ballarat is getting 90% of their kids better. Cool. All of us can understand that, right? And that's what's missing at the moment, a common language. I tell you, that's my bias to talk about numbers, of course. But whatever that common language is, I think we've all got a role in this, and we've got to just figure out what our individual role is and what we can do.
Absolutely. And as someone who also loves data, I agree with your bias because I think
Yeah.
that's a great way to communicate. I think it's the perfect language. But agreed, where it's something that you can't fight numbers when it's something like that, outcomes from students who have filled out a survey themselves. It doesn't matter what, all that matters is what they filled out on that form and what the outcome
Yeah.
is. You could
Yeah.
scrutinize it in a lab, but it's ultimately there are results that are happening due to moving pieces that come together in a really great way to support the community, that support teachers, kids, parents. Yeah, it's amazing work that you're doing, and I've really enjoyed this conversation. So I'll hand over to Vinita to close off the discussion today. But thanks so much, Nathan.
Thanks, Anna.
Thank you, Anna and Nathan. That has been such an exciting conversation, and I've been scribbling notes all the way through. And Nathan, I just, just listening to what you're saying, it is such a fantastic model that you have built together.
Mm.
You're not just supporting schools and school children who need that support early so that through their developmental phase in life, they've got that support early and then they can have better lives in adulthood. You're also
Yeah.
supporting the teachers, and I completely hear that they're expected to be, a teacher, social worker, and psychologist, which is impossible for anyone to do. So building capacity for the teachers is an absolutely fabulous outcome. I love the fact that you're also sharing hints and tips with the parents because,
Mm.
ordinary people who are living their lives on a daily basis may not have that language that you're talking about or the understanding of what the actual problem is that they can support. So it's fantastic that Psychs in School is able to provide data, not just for yourself to get more funding, but also
Yeah.
for the people whom you're supporting so that you're building capacity within those communities. I absolutely love that. I think that that's such an important factor. And the fact that you've talked about making the access simpler and equitable and affordable with a
Mm.
frictionless place-based approach. And from everything that we've done, and Anna and myself have worked in the financial space for a long time, we know that these are the triggers that usually stop people from taking action. If it's too hard to get somewhere, if it's too expensive to get somewhere, or if they need to do something and juggle, that's when they
Mm.
make a decision not to or procrastinate. So, absolutely fabulous that you've picked that up. I love the fact that you've got measurable outcomes, the fact that you're data driven and feedback informed and tailoring your service so that it's high quality, particularly the
Mm.
focus on complex care and the cases that don't work. Very often, it's very easy to just keep working on the cases that work and get better and better, but not
Yeah.
really think about those who are falling through the cracks. So I absolutely love the fact that you're doing that and you're making that a focus so that you can improve the complex cases as well. And then, of course, I have a selfish interest in the fact that you're
Mhm.
supporting placements for psychology. As you know, I'm
Of
shifting my
course.
career
Yeah.
and going into psychology. So I hope to be one of your, not early career maybe, but new psychologists who's really hungry and eager to do my very best to support your work. I love your
Absolutely.
future ambition as well. We know that when you provide a common language and give every single part of the health and well-being ecosystem a role to play, that's when
Mm.
you can achieve that system change and that shift in society that's needed. And I
Yeah.
hope that I can find ways to support your efforts to be able to articulate that common language, that common agenda, and give every single person a role to play. So, all the best to
Mm.
psychologists in schools. And thank you so much for sharing how we can build resilience in this tiny microcosm of a community, which is children in schools.
Thanks, Vinita. Thanks, Anna. I really appreciated it, and I really do mean that we've got all a role to play in this. So if anyone wants support from us on how to help their service, or is a great service that wants to work with us, have a look at www.psychsandschools.com. Our results are there. And again, if we just work together, rising tide can lift all boats.